And the negative side would be the NWU Northwestern University. Alright? So, debaters, are you ready? Now we have the first speaker from the affirmative side. You may start your 5 minutes to start.
Good morning, ladies and gentlemen, educators, and everyone involved in this conference. Our topic for the debate is, should drug education be a mandatory part of the school curriculum? As used in this debate, drug education refers to efforts to reduce drug-related harm through the delivery of structured social and mental health education curriculum within the school content, usually by classroom teachers, but in some cases by professionals. School curriculum refers to the lessons and academic content taught in a school or in a specific course or program, students in both secondary and tertiary. Part would mean that drug education should be included in the school curriculum as a separate subject for a long-term benefits. I am the first speaker and I will be talking about the necessity. The second speaker will talk about the beneficiality, and the third speaker will talk about the practicability. Drug education helps children and young adults to understand that all drugs, legal and illegal, have the potential to cause harm, and that drug experience is because of many factors, including the person, the drug, and the environment. How many of these incidents of young adults' exposure to addictive prescription drugs would have been prevented if they had known the potential harm and danger in drug use? How many of them would have known to stay away from drugs, thanks to having learned in school how dangerous drugs are? This issue is black and white. Young people are often exposed to drugs because they don't know any better. According to research, 41% of drug users revealed that they started to use drugs at the age of 15 to 19. That is why we are targeting students specifically in secondary and tertiary levels. Young people who experiment with drugs and alcohol risk permanently harming their motivation, learning, judgment, and behavioral control. The problem is, most young people don't know that those really are different risks of drug use. That's why it's so critical that young people learn about the harms and dangers of drugs before they are ever exposed to such substances. Given that schools play a significant role in young people's learning, schools are uniquely positioned to help prevent drug use among youngsters. Schools can offer educational seminars and lectures on the effects of drugs. They can teach practical skills on how to avoid peer pressure situations, which are very prevalent in our society nowadays. Youngsters are very easy to be subjected to addictive drugs because they are vulnerable given their age. Schools can even provide drug testing and intervention programs to help these students who are vulnerable to drugs. According to research, there are 3 primary reasons why schools are ideally positioned to offer drug education and prevention. First, drug prevention strategies are best deployed before people develop potentially erroneous beliefs about drugs. As drug education can begin with relatively young school children, such classes could teach kids the truth about drugs long before they hear myths and falsehoods about drugs from others. Schools offer a systematic way of teaching a large number of people quickly and effectively. Third, schools can utilize a wide range of resources and educational materials to deliver a comprehensive programs to kids. Having an open conversation about drugs and the dangers associated with recreational use is so important in the path to prevention. If schools can create a comprehensive drug education program and students feel safe to express their questions and concerns, we can potentially minimize drug use even more. This survey gave us important insights into how students feel about their education concerning drugs, and it can be used to improve discussions on the topic about drugs.
morning, ladies and gentlemen, honorable advocates. First, I would like to ask, are you aware of RA 6425? Are you aware that it was repealed? Yes. And are you also aware of the RA 9165, particularly Article 4, Section Article 4,
Yes.
Let me begin with my speech with 3, 2, 1. Ladies and gentlemen, esteemed members of the House, I stand before you today to urge the rejection of the proposition to add drug education in the academic curriculum in the Philippines. While I acknowledge the good intentions behind the proposal, I believe that it is unnecessary and potentially harmful because it is potentially harmful to our already overburdened education system. Ladies and gentlemen, our status quo right now here in the Philippines, according to the United Nations Office of Drug Crimes, it is currently lower than global average, and there is a decreasing trend of 50% since 2016. So what does this mean? It means that our system right now, the efforts of our law enforcement and our community is already effective enough. So first, our curriculum is already a stretch thin. Adding another subject, particularly one that is sensitive and complex as drug education, would place unreasonable burden on our teachers, students, and already strained resources. So we must prioritize core subjects and ensure that existing knowledge is delivered effectively before introducing additional content. So secondly, a one-size-fits-all approach does not work in drug-related issues or drug education. So the effectiveness of such programs varies greatly depending on age, socioeconomic background, and individual learning styles. So imposing a standardized curriculum across the board risks failing to resonate with specific student populations, leaving them undeserved and potentially more vulnerable. More importantly, the potential for misinformation and negative influence exists. Just like in the differential association theory, if the students will be exposed to this knowledge, they will be able to have those ideas, they will be able to interact with people who are exposed to drug situations and drug issues. They will learn, and that will pique the curiosity of the students to try for themselves instead of avoiding it. So providing information about drugs, even with the intention to discourage the use, could inadvertently pique the curiosity of some students. Without proper training and expertise, educators may unintentionally deliver inaccurate or misleading information, potentially exacerbating the very problem we are trying to solve. Instead of burdening our education system with a potentially risky curriculum change, let us focus more on, number one, strengthening the existing support system. Because why do we strengthen the support system? We are trying to cure the root cause of why people are committing drug-related issues, and that is poverty. So if we strengthen the support system that we have in the Philippines, for example, the poor piece, or giving livelihood projects to those people who are unfortunate, they will be able to divert them. They will be able to be diverted instead of engaging themselves in drug abuse. Number two, empower the existing social safety nets. That will be discussed by my second and third speaker. So one is, and also let us also promote mental health awareness, since this is also one of the root causes of why people are committing drug-related cases. So by focusing on these non-curricular approaches, we can create a more effective and sustainable solution to the complex issue of drug abuse in the country, in causes and ultimately create a safer and healthier addict society for all. Therefore, I urge this esteemed House to reject the proposition of adding drug education to the academic curriculum. Let us instead focus on the non-curricular solutions that I have outlined. So by doing so, we can create a more holistic and effective approach to combating drug abuse and building a brighter future for our country. Thank you.
First speaker, the meeting starts now.
Do you agree with me that education may change a person?
Yes.
Then, do you agree with me that proper awareness can reduce ignorance?
Yes.
Without drug education as a part of school curriculum, do you believe that they can receive it somewhere else?
Yes.
Would that be effective and they have the assurance that the instructors are proficient in that field?
I would prefer that, so yes.
Community-based drug education more accessible as compared to school-based drug education?
Of course.
You said earlier that strengthening support system does it specifically target the children because right now focus is towards drug education.
Yes, because family is the foundation of children.
Yes.
Your 5 minutes starts now.
Good morning, Mr. Order. On the specialty part, we believe that drug education should be mandatory part of school curriculum and we prepare 3 arguments to support our belief. First and foremost, drug education in schools plays a crucial role in preventing drug abuse among young people by providing students with accurate and comprehensive information about the dangers of drug use. Schools can help to minimize the chances of the experimenting with the drug in the first place. Research has consistently shown that early education about the risks and consequences of drug abuse can significantly reduce the likelihood of young people engaging in such behavior later in life. Secondly, drug education in school to equip students with a knowledge and skills that they need to inform decisions about drug use. Through a well-designed curriculum, students can gain an understanding of impact of drugs on the body and mind, the potential legal consequences of drug-related activities, and the various support resources available for individuals struggling with drug abuse. This knowledge can empower students to resist peer pressure and make choices and prioritize their health and well-being. Furthermore, incorporating drug education into school curriculum can help to address its stigma surrounding drug abuse and addiction. By fostering open and honest discussion about this topic in the classroom, the school can create a supportive environment where students feel comfortable seeking help and guidance if there is someone they know are struggling with drug-related issues. This can contribute to the overall destigmatization of drug addiction and encourage a more compassionate and understanding attitude towards individuals affected by it. Moreover, by drug education mandatory in school, we can ensure that all students receive consistent and evidence-based information about drugs and their effects. This can be particularly important given the prevalence of misinformation and conflict messages about drugs in the media and online. Providing standardized education on this topic can help to counteract myths and misconceptions and promote a more accurate and understanding of the risks associated with drug use. Lastly, there are strong arguments in favor of making drug education a mandatory part of the school curriculum. Doing so can help prevent drug abuse empower students with knowledge to make informed decisions, reduce stigma, provide consistent information, and contribute to public efforts. Introducing drug education as mandatory component of the education curriculums offer numerous important benefits. First, preventing drug abuse. Educating students about the risks and consequences of drug abuse can play a decisive role in preventing substance misuse issues. Second, promoting health and well-being. This understanding fosters a sense of responsibilities for one's health and well-being and enabling students to make choices that prioritize their physical and mental health. Next is empowering decision-making. By offering comprehensive drug education, the school empowers students to critically evaluate and make decisions regarding substances. And lastly, this stigmatization of drug addiction. This approach helps reduce stigma and promotes empathy and understanding, and encourages students to seek support to themselves and other victims of substance abuse. That's all I have.
Good morning, honorable speakers. Good morning, sirs. I would just like to ask, do you agree that the current curriculum is already overburdened, and adding another subject would be detrimental? Do you believe that the standardized curriculum could effectively address the diverse needs of students across different backgrounds? Do you think providing information about drugs, even for educational purposes, could inadvertently pique curiosity or normalize drug use? No. That's all for the... Adding drug education as part of the curriculum may contribute to negative impacts and contribute to a drastic effects in which results to ineffective products. One would be economic. Due to the addition of curriculum, parents will have to compensate into another paying of tuition fees of the child. According to UNESCO, 36% of Filipino families resort to loans to pay tuition fees of their children. With that, UNESCO says that 34 students drop out due to lack of financial support from the families. And in addition to the curiosity or lack of relevance, we could say that students especially Filipinos, are curious about the things that they have learned. And aside from believing in the context, they are curious to try something about that. And curiosity, according to the Makati Medical Center, 50% of teens experiments with drug at least once on their lives. It says that 50% of young students try drugs due to curiosity and experiments. And in addition, lack of interest with that particular subject. A research by Hindawi says that 36 to 44.1% of the students are reported of being lack of interest as a reason not to attend school subjects. Moreover, stigmatization and fear. As we can see that most of our fellow instructors are focusing on scare tactics. And according to the science of learning for teachers and students, students may interpret a teacher a behavior that is not necessarily for them to be accepted, such as unfair, scary, or providing such fear to them, which causes stress further for them to incomplete such needs for their academic. And also, in addition to this stigmatization, we could say that it is related to labeling theory. Labeling theory is someone you label, and based on the additional curriculum, if the students are well knowledge enough, or let's just say they're successfully adopted the institutions, what will happen to the people who are rehabilitated? They may receive harsh criticism because of the knowledge that they have attained. And when they will be returning to the community, it would be a drastic or it would be be a downfall for them as well. And including the lack of resources. This is primarily related to the Philippines. According to the Department of Education, lack of resources in infrastructure may affect the quality of education. Reported by Inquirer.net that there are not enough funds to address the issues of shortage in the budget of the schools. And according to Hindi Alcantara, Philippines remains to be one of the lowest budget grants in learning among Asian countries. Overall, in addition to that particular argument, overloading students is scheduled. It is based on the Philippines as well. According to Commission on Higher Education, Fortune, 260,000 are undergraduates in the Philippines who are juggling with work and studies. By adding another curriculum makes them struggling to get or to pay for their tuition fees as it was provided by their curriculum. And it may also result into stress as well due to overloading. As we can see, almost according to Cross River Therapy, 45% of students in high school are stressed almost every day in school, and 50% of teenagers are stressed over academic all the time, and including adding lack of qualified teachers. According to the research lead, teachers are reported as barriers to effective drug education. And lastly, age appropriation. It must be required or it must be tailored with a specific age. And I don't think that our current fellow Filipino children are capable enough to gather or acquire all of those knowledge. And it requires a lot of educational assistance supports coming from any possible institution. Aside from, so I don't believe that adding another curriculum may be better, and it will just burden someone's higher studies.
Good morning, everyone. Good morning, Mr. Speaker. My first question would be, would you agree with me that a person like you would teach drug education?
No.
So would you agree with me that do you know the effects of using drugs? So would you agree with me if you could teach those effects to simple individuals? And moreover, do you agree with me if the lack of decision making results to negative effects? So would you agree with me then if those negative effects result to crimes? Would you agree with me then that those crimes because of the lack of decisions, the lack of decision making would cost more from the government, especially the financial status of the government? Thank you for proving our point. Our speakers. Good morning, everyone. Good morning, educators. Good morning, fellow co-educators. Today I will be the speaker for crack debate. Under Section 43 of RA 9165, it is already mandated, right? It is already a law that in all public and private schools, in secondary and tertiary curricula, drug education shall be implemented. There are such instructions, there are 5 instructions. First, the adverse effects of the use and misuse of dangerous drugs on the person, the family, and the community. Moreover, the preventive measures against drug abuse. Third, the health, social, cultural, psychological, legal, and economic dimensions and implications of drug problem. Lastly, and of course, moreover, steps to take when intervention on behalf of the drug defendant is needed. And of course, lastly, the misconceptions about the use of drugs. Mr. Speaker said earlier that the students should have a negative idea to those persons who are under rehabilitation. So it's already covered in here the misconceptions of these for these individuals that they should not be stigmatized. They should not be labeled as someone who uses drugs for recreational purposes. So it is already included here, for information, Mr. Speaker, that it is about the misconception. We are focusing on the misconception of drug abuse. And of course, we are preventing the measures against drug abuse that would save the government. That would save the government from the cost of investigation, the cost of litigation, and lastly, the cost of imprisonment. Well, that would lead me to my second argument. The cost of investigation, example, the consumption of natural resources. If a person gets investigated, the police shall have excessive allowances that would should be applicable or shall be applied better in every other circumstance. Moreover, the cost of litigation, it would slow down, right? It would slow down our criminal justice education due to a large amount of court dockets. And lastly, the cost of incarceration. Because research have said that approximately 70 plus thousand is allotted for a prisoner for his annual allowance. Ladies and gentlemen, the student's allowance, annual allowance is approximately around 24,000 pesos, which is times 3 lower than the allowance of the prisoner. And my point here, ladies and gentlemen, that the government shall gain this long-term benefits. It would be more practical as we invest on these students to have a critical, to at least learn the fundamentals of drug education. And of course, it is already a law. Therefore, it is practicable. It is practical, rather. There is no need for excessive time and excessive use of money. And of course, in the long run, as we educate students, drug education, we are innovating for the future of our nation. And of course, it will assist the students to become professionals, to have a concrete decisions on not taking drugs because of these adverse effects. And these adverse effects that we will be educating to them in our mandatory drug education program will serve as a deterrence for them not to commit any drug-related crimes. Ladies and gentlemen, we are proposing for the improvement, for the development of our nation, the Philippines. That will be all our response.
Good morning. So, Mr. Speaker, I have two interpellations. So, number one is, do you think that one of the major problems of the educational system in the Philippines is insufficient funds?
Yes.
And number two, or last, is drug education can only be implemented in schools?
Yes.
Thank you. As a third speaker, who are in favor of the negative side of the implementation of drug education as a mandatory part of school curriculum, I have two concerns when it comes to its impracticability. Number one is overburdened curriculum, or we can also interconnect it with lack of funding. And number two is the unreadiness. Mr. Speaker, disadvantage, so it affects the quality of education to be affected. So in addition, many schools lack the adequate textbooks, classrooms, and teaching materials, which affects the students, which is challenging on the part of the students to learn effectively. And this is not only present in rural areas, but it is also significantly present in urban areas. So considering this the problems that we should not overlook, we should divert our focus on the what is already an issue in the educational system, and not adding a new subject that is very sensitive, particularly as drug addiction. So besides, it will not put the students in a significant disadvantage, because there are already free symposiums, seminars, lectures regarding drug education that are being implemented, conducted, or provided by the different law enforcement agencies here in the Philippines. So in addition to that, on the part of the students who are enrolled in private institutions, this will be considered as another expenses again. Since students who are enrolled in private institutions, they are obliged to pay for the subject they are enrolled in. So additional tuition fee. So why pay for a tuition fee? Additional tuition fee when there is already free symposiums, seminars, and lectures like what I've said already. In addition to that, there is what we call the KPDAT, which is stands for Kabataan Kontra Droga at Terrorismo, which is a youth movement in the Philippines that aims to combat illegal drugs and terrorism. Over 1 million members nationwide. So the movement has helped the raise awareness of this problem, and it has helped in reducing crime and promoting peace. So when it comes to readiness, we can say that the education it is already without doubt in the current status quo that the educational system is already struggling from understaffing, outdated resources. So we must have to demand a grand education. We must have a skilled instructors and substantial resources. We must ensure that these educators have who are skilled enough or are adequately prepared to have the utmost professionalism and factual accuracy before mandating. So we believe it is still in our best interest when it comes to from the first speaker to the third speaker that a drug education should not be a mandatory part of the curriculum.
Good morning. My first question is, are you aware of Article 43 of RE 9165? It mandates that drug education should be integrated in the school curriculum. So, do you think that that provision should be removed? Because you believe that drug education shouldn't be part of the school curriculum. So, do you think that it should be removed from drug provision should be removed? Yes. So, you want it to be amended or revised, right? So, if we want to revise it, are you aware that revising it costs so much resources, time, and money, and that costs as much as drug education? No. Thank you.
Okay, team captains, given 1 minute, prepare your battle speaks. Summarize the advantage, disadvantage, the weak points, and the strong points. 1 minute, please. the streets.
Ladies and gentlemen, we are standing here in the opposition side, the negative side, for the motion, should we add, or should drug education be added in the curriculum? That means that should we create another, or should, is it mandatory for us to add drug education as a separate subject in every curriculum? So number one, let me state this. We are not just looking for the welfare of the students. We are looking for the welfare of the whole society. So that means, by the way, there are out-of-school youth. There's a lot of out-of-school youth who are involved in drug trafficking and drug-related cases who cannot be catered by the drug education that was provided in the drug education curriculum. Because, first of all, they are not involved in the school. They don't have that access to that education. Number two, there are already programs, outreach programs, community-based programs that are already effective as of on the dangerous drug board's records. I've already mentioned earlier that there's 50% trend of decreasing number of crime-related cases in the Philippines since 2016. So that means that the outreach programs, all the programs that were provided by our law enforcement are effective enough and doesn't need, we don't need to add a burden in the education system so that they can focus more on their core subjects. And this would lead to a better progress of the students since they already have access to drug education outside the school. They can focus more on what they should be studying inside the school. So there's a collaboration between the community and the school. If they have separate, or if they have separate education that they can impart not only for the students who can enroll to the schools, but also for the youth and the whole nation. Thank you.
You have said earlier, Ms. Speaker, that you have included the out-of-school youth, but sad to say, out-of-school youth is not within the parameter of this debate. You have said earlier that it causes unnecessary potential harm because we are so bombarded with so many programs and that our curriculum has already stretched to from ed standard curriculum. But drug education shouldn't be complicated. We wouldn't be creating complicated essays. We are not going to memorize countless terms. It should encourage coordination and participation through interactive activities. Second, you have mentioned earlier that it is a one-size track approach. Track education consists of various programs in a long-term duration for a long-term benefits. Third, you have mentioned we should just strengthen our support system, which targets the poorest and creating or promoting livelihoods for the family. But it doesn't specifically target the students, because right now our sole focus is towards the students in the implementation of drug education in the school curriculum. And because we aim to develop a close relationship between students and professionals for a more effective, efficient, and comprehensive drug education. By investing in prevention through education, we can potentially mitigate the need for more costly interventions down the line. Furthermore, incorporating drug education into the school curriculum can help to address the stigma surrounding drug abuse and education. Drug education schools help to equip students with the knowledge and skills they need to make informed decisions about drug use. Moreover, by making drug education mandatory in schools, we can ensure that all students receive consistent and evidence-based information about drugs